Hi dudes, I'm Vusi and I'm so proud of you for making the decision to be medically circumcised. You can meet me outside at the recovery area. It is my job to ensure that you know how to look after yourself after the surgery and to make the right decisions for your health. After surgery, you will be taken to the post-operative care area where the nurse will look after you whilst you recover. Whilst you rest in the post-operative care area, you will be provided with a small snack as part of our post-medical procedures to ensure that you are well enough to leave the clinic. The nurse will take your blood pressure and record your vital signs on your medical records. This is done to ensure that you have recovered sufficiently before you leave the clinic. Should you feel that you need to talk to a counselor after a medical circumcision, please tell the nurse and she will call the counselor to talk to you. Your emotional and physical well-being is important to us. The nurse will ask you to complete a client satisfaction survey to let us know if you are happy with the service you receive. If you have any suggestion on how we can improve our services, or if we have done anything to disappoint or upset you, please let us know. Your experience in our clinic is important to us. Within half an hour, you should feel well enough to leave the clinic. You can walk home or get a taxi, but do not ride the bicycle. After the MMC procedure, it is important to rest at home for 48 hours. However, the recovery period varies in each client.
How soon can I go to the toilet?
Immediately when you have an urge of going to the toilet.
When can I take a shower or a bath?
You can wash your body, but do not let the bandage get wet. You can take a proper bath or shower when the bandage is off.
When must I clean the wound?
24 hours, that is 1 day, after your circumcision, prepare to clean your wound. Washing your hands. It is important to wash your hands with water and soap every time before touching the wound. You can also wear disposable gloves that you can throw away after cleaning your wound. Prepare the following items to use to clean your wound. A clean bowl, 350 ml of warm clean water, that is a cup, and 2 teaspoons of salt. Prepare a weak salt water solution, that is 2 teaspoons of salt diluted in 1 cup of warm water. Remove bandage 24 hours after your circumcision. If the dressing stuck to the wound, soak in warm salt water and remove the dressing gently. How to clean the wound? Wash the wound with clean bare hands or wear disposable gloves. It is recommended that you wash your genitals gently 3 times a day with a weak salt water solution, that is 2 teaspoons of salt diluted in 1 cup of warm water.
Must I apply any cream or ointment to the wound?
You are not allowed to apply anything. You need to keep your wound as dry as possible.
After you clean the wound, what must you do?
For the first 2 weeks, strap your penis in an upright position against your abdomen using the tape provided or elastic band on your underwear. You should wear loose, clean underwear and change your underwear daily to prevent possible infections. It is normal to experience some pain after your circumcision as the pain injection wears off. After the operation, you will be provided with pain medication. You should take 2 tablets 3 times a day or only when you experience the severe pains. The pains normally settle down after a couple of hours. The stitches are dissolvable stitches and disappear by themselves. In most cases, if you follow this instruction and look after your wound properly, it will heal quickly without any complications. Bleeding after the operation. You might see some blood through the dressing after your circumcision, but this is normal. If the bleeding continues after the medical procedure, hold your penis in your hand with the penis upright facing the abdomen and squeeze the bleeding area, applying constant pressure for 10 to 15 minutes until the bleeding stops. If the bleeding continues, continue squeezing and call the emergency number. Return to the MMC clinic or go to your nearest community health center for a doctor to assess you. This information is provided on the back of your appointment card. If pain is still excessive, please contact the MMC clinic on our emergency number or visit the nearest community healthcare center or hospital. Increased painful swelling, inability to pass urine, or painful urination. If any of the above occur, please return to the MMC clinic or to your nearest community health center for further treatment and review by your doctor. Discharge of pus or fluids. This may indicate infection. Please contact the MMC clinic on our emergency numbers. Alternatively, you can visit the nearest community health care center or a hospital. Please do not miss your follow-up visits, as it is important that a medical professional checks you to ensure that you are healing properly. Your first follow-up will be in 2 days after your circumcision. Your second follow-up visit will be in 7 days after your circumcision. If you are concerned about your healing or any other health matters between your scheduled visits, please do not wait but rather come and see us so that we can discuss your concerns. We are here to ensure you make the right decision about your health.
How soon can I return to work?
After your 2-day visit, you may go back to work.
How soon can I return to school?
You need to come to MMC clinic on the second day for your 48-hour follow-up visit, and then you may return to school. You may book an afternoon appointment for your day 7 visit.
How soon can I return to sport or other strenuous activities?
After 4 to 6 weeks, you can play some disc or any other sport. You must not have any form of sexual intercourse or masturbations for at least 6 weeks after your circumcision. This is to ensure adequate healing of your penis and prevent the wound from breaking down. Engaging in sex too early after circumcision can delay the recovery period or increase the risk of HIV transmission for you and your partner. Remember, MMC does not provide 100% protection from HIV. Always use a condom. Be a one-woman man and reduce multiple partners. After the MMC procedure, you must still use a new condom correctly and consistently to protect yourself and your partner. Should you be uncertain on how to use a condom, please call the MMC clinic and one of the staff will provide you with this information. This is also important in preventing the transmission of sexually transmitted infections, as well as HIV and AIDS. Remember, safe sex, including condom use, prevents you from becoming infected with HIV. With love comes the responsibility. Be extra sure you're extra safe.